all the people who are watching us. Dr. Mohit is here. He's a cardiologist and he holds very special interest in heart failure care. So today he'll be sharing a lot of tips and suggestions with us regarding heart health. So we are discussing the topic of ROS, reactive oxygen species, today with Dr. Mohit. So for all the people who don't know, we'll just get right into it. So my first question, what exactly do you mean by reactive oxygen species, Dr. Mohit?
Mehak, I have just a question. You want me to speak in English only, or you want me to be using Hindi as well?
I think English is fine. Hindi bhi theek hai, English bhi theek hai. We have an audience
Yeah.
who don't know easily समझते हैं.
So first of all, I would like to thank the Healthy India Project for inviting me, and they are doing a very noble cause. They are trying to, fight this misinformation, medical misinformation, which is a domain which is so prevalent. And of course, everybody trusts non-doctors more than doctors on medical information. So you are doing a very noble job, and God bless you for that. So,
So much.
so today the topic is basically ROS, or reactive oxygen species as we know it, especially in patients with diabetes or patients with generally as we known as non-communicable disease, which includes a spectrum of diabetes, hypertension, atherosclerosis, heart failure, something like that. So as everybody must have studied during their high school chemistry, so there are multiple types of chemical reactions which give rise to oxygen and certain free radicals. So what happens in human body also, there are multiple chemical reactions which are going on in different organelles of our cellular structure. Now for diabetes and for the scope of this talk, which is for general public, I would like everybody to understand to focus on one cell organelle, which is mitochondria, which we call as energy powerhouse of any animal cell, or for that matter, human cell. So in that particular mitochondria organelle, there are electron transport chain reactions which are taking place, and free electrons are released. Now, whenever these free electrons are taken up by oxygen, they make a thing called reactive oxygen species, which is a super oxidized particle which is charged and which is, kind of a free radical roaming around and looking for a substrate to react with. Why this becomes important in diabetes patient is that because of hyperglycemia, that is increase in blood glucose levels, the formation of these reactive oxygen species is accelerated. And these patients, then reactive oxygen species, they kind of react with different cell organelles and called oxidative damage.
Right. And what do you mean by oxidative stress, as you said, and how does excessive production of ROS contribute to oxidative stress in people,
Yeah.
especially with diabetes?
So again, for a lay person, oxidative stress is a very simple phenomenon. When there are too many reactive oxygen species which are being produced, then which are being degraded by human body's antioxidant mechanism. So you can understand, like we do in calories, now there is a calorie meter, you're in positive calories or negative calories. There is a ROS meter which is always working. So a normal human healthy body, this ROS meter works like the amount of ROS being produced by body is being neutralized by body's own antioxidant mechanisms. What happens, however, in diabetes is that our natural antioxidant mechanisms are being suppressed, and this ROS secretion or formation is increased multifold times, which then leads to free radical injury, or we call what we are calling scientifically as oxidative stress. This oxidative stress kind of acts on different organelles in our organs in our body, especially on your kidneys, on your heart, on your blood vessels, on your neurons, that is nervous system, on your eyes, that is ophthalmology system. And this free radical injury, because of this oxidative stress, then leads to target organ failure.
Okay. And are there any, is there any routine or are there any specific activities or exercises, lifestyle factors that can help a diabetic person manage this oxidative stress?
So very good question. This has been question which has been chased by scientists for now over 100 years, because as we have experienced, whenever you are doing a strenuous physical activity, you feel pain in your legs, you feel tired. All this is because exercise actually induces in secretion of these ROS, and thus you feel these kind of oxidative stress induced local lactic acid production, local free radical injury. That is why all this pain is happening, fatigue is happening. However, it has been found that if you exercise regularly, and if you do a aerobic exercise regularly, then over the period, long term period, through a mechanism which is generally unknown to us as of now, clear cut mechanism, this free radical injury reduces, the inflammation reduces, and we have healthy kind of healthy results. So a long term regular moderate level physical activity is number one point. Secondly, of course, is diet. Now you have to take lots of fresh fruits and vegetables in your diet which have natural antioxidants in that, which kind of help your body's antioxidant mechanism to kind of neutralize these ROS or free radical as we call them. Then you also have to avoid certain things which is very important. You have to avoid smoking, you have to avoid certain drugs, you have to avoid radiation exposure, you have to avoid chemical exposure, you have to avoid stress in your life, because stress itself kind of induces these free radicals and causes free radical injury.
Got it. And these were some amazing tips. And I think it stays common for all the conditions that you have to reduce stress, that you have to, eat a good diet. Physical activity is also important. So, can you also provide us some tips for effectively monitoring blood sugar levels to minimize the production of ROS
Yeah.
and prevent diabetes related complications?
Yes. So this is especially for our patients who have diabetes. Of course, for patients who do not have diabetes per se, you don't need to measure your blood sugar and again and go into panic. But for those who have diabetes, every 3 months you have to get your glycosylated hemoglobin test done, which we call as HbA1c. And that HbA1c has to be somewhere around 6.5 to 7. That means that your sugar control is tight. For patients who are diabetes for longer times and who have uncontrolled diabetes, you also look at a fasting blood sugar and a 2-hour postprandial blood sugar to adjust their medicine and cause a kind of uh, normal glucose levels, because no, the glucose levels per se also come in crest and trough. You have a basal insulin secretion, and after your meal the insulin secretion increases periodically. So for patients who have uncontrolled diabetes, we put them on insulin also, which has a mixture of basal and bolus insulin. And there are certain drugs which kind of decrease insulin resistance and thus causes normoglycemia levels. How often you have to do it? Of course, if you are diabetic, you have to do it every 3 months without any indiscipline in that. If you are not diabetic and if you are above age of 40, then I would recommend that you should at least get this thing done once a year in your regular health checkup. And it is not only glucose monitoring which is important, it is also the lipid monitoring. So you also have to keep your LDL cholesterol into check, because LDL cholesterol, whenever it increases, it has been found that it increases atherosclerosis, it increases inflammation, and it increases your general body's tendency to develop atheromas and to develop free radical injuries. So you have to keep your lipid control by taking medicines, by doing lifestyle measures, and of course you have to control your HbA1c.
Got it. And before we get to our next question, I would like to tell all the audience who has joined right now that we have an amazing community about diabetes, and it's named as Sugar Smart. And if you're serious about diabetes management and would like to connect with people who are also on their diabetes journey, you can just join the community. The link is in our bio, and we bring super amazing experts like Dr. Mohit for a live session every Thursday at 6 p.m. So if you're serious about your diabetes journey, if you want to share your victories, your challenges, your goals, you can just share that with an amazing community that we have on WhatsApp. So next question. See this we have already discussed also, but maybe you can enhance a bit on it. Are there any practical steps to minimize exposure to environmental factors that may increase ROS levels, such as pollution or smoking? Could you just
Yeah, so there are,
talk about
of course, because I am sitting in Delhi and I guess even you are sitting in NCR, so we
Yes,
are automatically exposed to so much pollution. So we have to avoid going outdoors in the without our mask in this particular season of the year. We should try to have air purifiers at home. I know it's not possible for everybody. And whenever you go out, do a masking, like you should always wear mask. It will protect you not only from pollution, but also will protect you from viral illnesses, which are very prevalent during this season of the year. Second, of course, is big no to smoking. Now we have seen that smoking was a craze and is a craze since 1970. Hippie culture has been there, but youngsters have to understand that smoking actually is very, very harmful. Not even for free radical injury, all young heart attacks we are seeing, all young people dying while doing their gyms or doing some dances. If you go deeper into their histories, you'll find that most of them have exposure to smoke, whether direct or indirect. But what indirect smoke means, I know many youngsters, they do not smoke, but their friends do when they're sitting in front of them. So you have to understand that passive smoking is also giving you at least 50% of the damage. So you have to completely avoid smoking. You have to avoid your friends smoking in front of you. You have to avoid pollution by not going out without being masked properly. You have to, if you can, install air purifiers at home. Then, of course, there are certain drugs, especially substance abuse, which is rampantly common in younger generations. You have to avoid them. You also have to avoid unnecessary medication. You should always take medicines under proper medical supervisions. You have to avoid unnecessary herbal medications, because what happens is that herbal medications are being sold as if they have natural antioxidants. But what ends up is that they have very heavy metals, and these metal induced free radical injuries can actually harm your liver, they can harm your lungs, and general overall health. Last but not the least, if you are a professional like us who goes into radiation, you have to try to minimize your radiation exposure. Then if you are working in some asbestos company or silicon company, or you are working with ceramics, you should minimize your exposure to those free radicals, which might also induce some kind of injury in your body.
now that was very shocking also, like the smoking part especially, because when we are with our friends and family members, if people smoke, we do not generally take it very seriously that people are smoking in front of us. We just sit there and continue. But this has really bad impact
No,
on
it
the
has.
daily life.
That is why smoking at public places is banned in our country.
Right.
Unfortunately, that's not being followed, but that is law of the land.
Hmm. Correct. That is very true. Uh, I I have one last question from my end, and then if anybody has any question, they can just go ahead and ask Dr. Mohit about anything about heart you want to know. What are some daily habits or routines that people with diabetes can establish to support a heart healthy and low ROS lifestyle, and
Yeah.
while managing their diabetes as well?
Dietary measures have to be done. I would straight away come to the physical activity part, which is very important. So, a moderate intensity exercise of 30 minutes a day for at least 5 days a week should be done. By moderate activity, I mean that you have to walk briskly. We don't expect you to do a strenuous exercise. We don't expect you to run marathons. What we expect is a moderate intensity workout of 30 minutes, at least for 5 days a week. And if you mix it with some strength exercise, with some weightlifting, nothing better than that.
So that's